Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out, or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I'm really excited to have with me on the show Dr. Aviva Schein, who is a general pediatrician for over 20 years. She has worked in a few different settings, and currently, why I wanted to have her here today is because she's really enjoying her career working at a federally qualified health center, and thought that would really be worth chatting about. So, Aviva, first, thank you so much for joining me.
You're welcome. I'm so happy to be here. I have to just say on the air, I've listened to a bunch of your podcasts and I think they're great. Such interesting people you're getting to meet. And
Oh, thank you
yeah,
so
no,
much.
you're welcome. And I just love the way, like I was thinking about how there's a few doctor podcasts that I really like, and that doctors actually make good journalists in a way, because we've been trained to ask questions thoughtfully and like give people time to answer. And, I think you do a great job.
Oh, that is so, so nice. And you know what? You're right. We have skills we don't think that we have.
Mhm.
So it's nice to point that out for people. So I also want to point out for our listeners, this is extra special for us. You know, Aviva, you and I have a dear, dear friend in common, which is how we met. Like my best friend from like elementary school, who I'm still friends with, became your good
Best
friend
friend from adulthood.
from
Yeah.
adulthood. And she sort of introduced us, and then we ended up at our kids at camp together. So we would sort of run into each other occasionally in the summers. And so it's nice to reconnect, and I can't wait to share our conversation with our
Yeah.
mutual.
Yeah.
All right. So why don't you start, as I frequently do, by telling people a little bit about your personal journey and how you became a doctor and
Sure.
wherever you want to go with it.
Yeah. So, I mean, I come from a family where we have quite a few doctors in my family. My father was a surgeon. Um, Way back in the days of the giants, it was a different world back then. And, he was truly passionate about being a healer and being a doctor. And so I think I always thought about medicine growing up. And but by the time I got to college, I was really much more interested in the humanities. I didn't take any science classes at all in college. I wasn't pre-med. I was a history major. And I did some other stuff after college, but then within a few years decided maybe I wanted to revisit the idea of medical school after all. Wasn't sure if I could even do it. I had to take all my pre-med classes. So decided I would do physics first because I thought that
Mhm.
would be the hardest. And if that went okay, I could do the rest of it. And yeah, that physics went okay. So I ended up at medical school.
Did you work for a while after you got your
Um,
humanities degree?
I I was applying to graduate school. I wanted to get a PhD. I traveled. I
Yeah.
lived abroad for a little bit. I did some research. I ended up actually doing a little research in healthcare policy in England, and I lived in Israel for a little bit. So yeah, I did a bunch of different things. I only took 3 years off, and part of that was doing the post-bac pre-med classes.
Yeah. I wonder if you had fallen into a career or a different job, if this path would have even.
Oh yeah, 100%. I think about that a lot.
Yeah. So interesting. All right. So your dad was probably super proud.
Yes.
Right. And
My mom
then,
too. Yes.
yeah, the days of the Giants. Okay. So then tell us what happened. Where were you working? Why peds? How'd you go from there?
So I always loved kids. I mean, I think most of us who went into peds kind of knew, or many of us had that interest even before medical school. As a field, it's so positive. Kids are so resilient.
Hmm.
Um, you know, Development is so interesting. You feel like you're really making a big impact on people's lives. I enjoyed residency. My first job out of residency, I worked for 6 years at Maimonides Hospital in Brooklyn at their continuity clinic.
Mm.
So I had a panel of patients, and I was also supervising residents. And I was a little bit involved in medical education. I worked with them on OSCEs and stuff like that. And that was a fantastic job. It was just great patient population, really wonderful colleagues. The doctor who ran the clinic is just like a mentor and such a kind, wonderful physician and human being. And yeah, I loved that job.
So why did you
Um,
leave?
I
Sounds
leave because
perfect.
I moved because I had
Ah,
to leave New York City, and it's hard to find enough space to raise kids in Brooklyn, and so we moved out to New Jersey. And I thought about for a minute commuting to that job, but that wasn't feasible. Um, so then I went into private practice in New Jersey, and I did that for 15 years. And I think at first I really enjoyed it,
mhm.
even more than I maybe thought I would enjoy it. I worked and saw patients in the community that I lived, which is always a unique thing. I took care of a lot of my acquaintances and friends' kids, which is, not something for everyone, but I enjoyed that.
Yeah, were you
Um,
able to set boundaries? Some of my colleagues
Not always.
do that, right? They
Yeah,
end
yeah,
up,
not always. So I learned over time. And but it was nice because the community, so you kind of understand the school system and the sports and what's going on, and the dynamics.
that is
So
nice. If you can
yeah.
strike that balance and you don't feel like you're at Target and people are, showing you their rashes.
Yeah. Or you're picking up soda for like the soccer end of year party, and your patient walks by and sees your shopping cart full of soda.
Ah, the
You feel kind of
judgment.
guilty. Yeah, yeah.
Oh
Um,
my.
but yeah, so I did that for a while. And but over time, and I think you and I have talked about this, medicine kind of changed. It was always a very busy practice.
Mhm.
And in the beginning, that was okay. It's actually a learning opportunity when you're seeing a lot of patients, and
Sure.
especially in peds where, a lot of what we do is a little bit of the same. And so you have to see volume to see some of the interesting things. But the volume just became more and more.
Yeah.
And for me, it wasn't satisfying. Um, and I was thinking about this in preparing for talking to you. And I think I started really thinking about leaving probably around 2018, which is when I had one child who was a senior in high school. And I thought, this is not for me forever. And what am
Mhm.
I going to do instead? And it's really hard to kind of move on and figure out what you want to do when you've done something for 15 years and it's very comfortable. And my office is 3 miles from my house, and I knew everyone there really well. And I had no idea what else was available, or if I could find something else, if there was anything better, or was this as good as it gets?
Mhm.
Um, and I I talked to a coach at the time. I read a little bit about coaching, and I found someone who was both a pediatrician and a life coach, and kind of a work coach for doctors who were a bit frustrated or burnt out. But I didn't really start working with her until after COVID.
Mm.
And I think something about COVID, of course, a lot of people rethought things during COVID or after COVID. But what I think was interesting is that during COVID, all of our practices changed, right? We stopped seeing sick patients
Yeah.
because we didn't know who had COVID. We couldn't test them for COVID. And remember that crazy thing? First, it was like, we're not going to see people who have a fever because they might have COVID. But if you don't have a fever, you don't have COVID. Oh, wait, no, fever or cough. We're not going to see people with fever or cough. And then it was like, well, actually, you can have GI symptoms, or you could have COVID toes, so it could be a rash. So all of a sudden, our office never closed, but we were just seeing mainly well visits and what we considered non-contagious sick visits.
Mhm.
Um, and so all of a sudden, it was much slower. And even though COVID was a time of great tragedy, and we all knew people who were impacted, and if you were in the tri-state area, it was scary, and you saw you know morgues set up on the street in New York City,
Ugh.
and we all knew of physicians who had died of COVID and people who were getting really sick and not recovering. But there was something about the pace of life in the office that
Yes.
was actually nice. Do you remember that?
Oh, very much so.
You
It
could
was a
spend,
very challenging time, but also
yeah,
there were some, yeah. But also
yeah,
the patients were like afraid to come in. This is all
yes.
beginning early,
Mhm,
early
mhm,
COVID, right? So it was
mhm.
like birds chirping and
Yeah. So there was like a month or two where patients were afraid to come in, but people came in with babies and people came in to
right,
get vaccines.
right.
And then after the first couple of months, people were coming in for their checkups.
Mm-hmm.
Um, and they had all these things they needed to talk about because their kids were homeschooled, or,
Right.
they were trying to do stuff on Zoom and they were trying to work and deal with their kids. And maybe some of them lost grandparents to COVID, or, just were dealing with all kinds of mental health issues. But I wasn't having to see them in like 15 or 20 minutes anymore. I could take 30 or 45 minutes because it just wasn't that busy.
Yeah.
And I was like, this is what I like. Like, I really appreciate having some time to spend with my patients and talk to my patients. And I'm not going to get that where I am.
That's
And
so interesting. You pointed out at the beginning a little while ago about the benefits of the volume, and I hadn't thought about that, but it's true. Like when you're first starting out, especially in peds, right? You've got to
yes.
see a lot, so you know which one of those vomiting
You want to
kids is
look
the
at
one to worry
hundreds of
about.
ears. You want to listen to
Right.
lots of lung sounds. And yeah.
Yeah, I think that was part of one of the things that I mean, I know we aren't like the dinosaurs like your dad, but we sort of are from the generation before there were any regulations around how many hours we work during residency. And I
Yes,
remember
yes.
when they started putting in the hour limits, we were like, oh, there are new trainees, they're not going to know how to follow up and they're not
Right,
going to know what
right,
this looks right.
right,
So,
right. Yes, yes. But there's volume and then there's 50 patients a day on the weekends.
right.
Um, yeah.
No, for
You reach a
sure.
point of diminishing return.
Mm-hmm. Okay, so you got a taste of something that you thought might pique your interest. First, you were sort of feeling a little bit like, oh, is this all there is?
Yeah, I mean,
But
I
you weren't
think,
quite sure what you
right,
wanted.
right, right. Yeah, because I thought this is corporate medicine. It's all like this. It's
Mm-hmm.
all about volume because reimbursement isn't great if you're not doing procedures, um and it's either six of one, half a dozen of the other. I'm working in a practice where the weekends are really intense and we're rounding and then staying in the office till from 8:30 till 4 and maybe seeing
Mm-hmm.
40 plus patients, but I only have to do this every other month. If I go somewhere else, maybe it'll be less volume, but it'll be more frequent. So it's going to even out. But then I just reached a point where I felt like I had to look. I had to know if there was something better for
Mm-hmm.
me. Again, for some people, that kind of setting was great and they're still there and, enjoying themselves, some of them, in that way of doing things. But for
Yeah.
me, I knew I had to look and see what else was available, even just to say there isn't anything else available.
Right. I mean, for me, my main mission here is that yes, that setting is perfect for those who love it. But I want to speak to the people who are in that setting, who don't like it, but aren't feeling empowered to do what you did, because there are so many things, so many options for us.
Yeah,
And I
yeah,
really want to, help people to open up
yeah, yeah.
take off
Their
their
world.
blinders. And
Yeah,
so if you
yeah,
could share a little bit more about your journey and then where you
yeah,
landed is so
yeah.
interesting and might appeal to people.
Yeah, yeah. So when I started working with this coach, and everyone has a different way of approaching these things, but her first step was to think about my ideal job and to just write down everything that I wanted in a job without putting any limits on
Mm.
what that might be, and to get very granular and specific, what kind of patients, how many patients do you want to see a day? What kind of colleagues, what kind of hours, uh, where, what kind of population, what are you looking for compensation, all that kind of stuff. Um, and I even took it one other level, which my coach really enjoyed, which is I said, in addition to these specifics, there's certain things I want to feel like I want to feel appreciated. I
Mm-hmm.
want to feel empowered to make changes. I want to feel intellectually stimulated and challenged. And I had this whole list of ways that I wanted to feel
Because
also.
all of those things speak to your core values. And everybody has different core values. And you were, really getting insightful with that.
Yeah.
That
Yeah.
exercise you went through, I often like to point out to people, we do that when it comes to buying a house, right? You put all of your dreams of everything you want, and then you decide which ones are negotiable and which ones aren't. Why don't we
Yep.
do that when it comes to our life?
Yep. Yeah. Absolutely.
Such a powerful exercise. So,
Yeah. Yeah. Um, and then, some of it was just, I think having a coach for me was really helpful in keeping me honest and making sure I followed through, and I knew I
Mhm.
needed that. Um, I think, what's the saying? If when the student is ready, the teacher will appear.
Yes,
And that
that's
was definitely true for me. Like I was very ready. And so I was very good at following through on what I was supposed to do. And, some of it was practical, like, doing your resume and making a
right.
LinkedIn page and stuff like that. And then some of it, a lot of it was networking, which is not my favorite thing to do.
Right.
And I think that you in coaching you do a lot of like reframing and is this, how can I look at this? There are different ways you can look at the same situation in multiple ways, and it can
Hmm.
be good or bad. So networking, I tried to look at it as like reconnecting with people who I hadn't talked to in a long
Yeah.
time. And some of it was, and some of it was very gratifying in that way. Old colleagues, old
Hmm.
mentors, hearing interesting stories of what people were doing. Um, and some of it was not easy, of like putting yourself out there and telling people, I'm not sure what I'm looking for. This is my ideal job. If you know anyone who's looking for anyone like this, have you heard of anything like this?
Hmm.
I looked at a lot of different things. I looked at public health jobs that were not clinical at all. I interviewed for a couple of jobs that had no clinical part to them. I looked at a lot of different private practice jobs, and I discovered there are a lot of different ways to run a private practice.
Yeah.
um, and there are different priorities and that you can place on what you're doing in a practice. And it's not all about volume, but you may be trading something. If you're
Right.
not seeing volume, there are trade-offs. And as I think you and I have talked about, everything is a choice, and
Yeah.
you choose what's important to you, and
Yeah.
just be aware of that as
Yeah. I wonder, Aviva, do you ever use, we're very logical, left brain doctors. We make our pros and cons list, and you can like spin it 8,000 different ways. But do you ever just sort of let go of it all and just sort of tap into how you're feeling and your gut intuition
Hmm.
through the process?
Yes, I mean, I think sometimes, a lot of times, your gut intuition kind of overlaps, at least for me, with the logic. I mean, there was a job that I really seriously considered just because I was tired and kind of burnt out, and this job had great hours and great
Hmm.
pay, but it was still very high volume. And I was like, you're not going to like that. That's not for you.
Yeah.
Um, and and there was another job that I considered with people who I knew and really liked. And I went to their office a couple of times, and they were all very happy, but it was still a lot of volume. And I was like, not quite right.
Yeah.
Um, and I ended up, before I worked where I am now at a federally qualified health center, I actually spent about a year and a half, just over a year and a half, at a small clinic, seeing mainly a Medicaid population. And that was like a nice kind of breather, where I was seeing far fewer patients. My hours were much better, but there were still things about that setting that weren't ideal for me.
Hmm.
And at that point, I was like, oh, I know that there's more out there. Like now,
Yeah.
and I know that I can do this. And I know that there are possibilities that, I'm not necessarily aware of that exist.
Yeah. You got that empowerment.
Yes, yes,
All
yes.
right. So tell us
Yeah.
where you landed and how long did this whole process take for you?
So I would say, from the time I started thinking about leaving, I mean, I probably thought on and off for many years, but
Mhm.
I remember in 2018 or so contacting this coach and then kind of letting it slide. I had a kid who was graduating, and then COVID hit, and nobody's moving
Mhm.
jobs in the midst of COVID. But as soon as things started to pick up again after COVID, I was like, oh yeah, this is why I wanted to move on. And I called that coach back and I was like, I'm ready. I'm
Yeah.
ready to buy like 12 sessions and see where I can go with this.
Yeah.
And then it probably took at least 6 months till I like accepted a job,
Mhm.
maybe 6 to 9 months. And then, of course, I took 2 months notice, and then I was at that job for 22 months, but I knew within a few months that ultimately I was going to be moving from that job, even
Yeah.
though I liked a lot of things about it. And this was like a contact that I had had. It was actually a colleague of mine who had also left private practice, who had joined Zufall, which is this federally qualified health center, community health center. And just from what she told me about it, I was like, wow, that's great. That sounds like exactly what I want to do. And she said, well, they're opening a new office right near you. And, let me put you in touch with the medical director. And so I talked to her. And so we knew for a while, I was just waiting for this new building to be ready. But I knew for a while that I was going to be
The
coming on.
networking paid off.
Oh, yeah. Yeah.
So tell us about the job.
So yeah, so just like a little bit about what a federally qualified health center is. So because I didn't really know beforehand. So a federally qualified health center generally, or a community health center as they're also known, serves an underserved population. And we take Medicaid and also offer a sliding scale fee for people who don't have Medicaid or don't have insurance. And the part of the way that it works is that FQHCs get what's called enhanced reimbursement from Medicaid and Medicare. So they get reimbursed at a higher rate, and also the federal government covers their malpractice insurance. And in exchange for that, we serve the underserved, and we provide like such a range of services. So there's, obviously general medical services, but there's also mental health services, which are integrated. And I can talk a little bit about that because that's been one of the main things that I've been really impressed with, at how mental health services are integrated into the practice. We have dental health. We have care coordinators who help with a variety of other things that I could speak to. And yeah, so it just is a way to really feel like I'm working as part of a team. We have internists, family practitioners, OBGYN, prenatal care, and peds all in my office. So, just in terms of talking about mental health, if I have a mom,
Wait, and you get to use your Spanish.
and I get to use my Spanish, yeah. So that was when I worked in Brooklyn. All my patients were from, well, 90% of my patients were Spanish speaking. It was mainly people from Mexico at that point in time, at that part of Brooklyn. I took Spanish in high school. Thank you to my wonderful high school Spanish teachers. I did not pay enough attention in Spanish class in high school. I keep telling my kids, this is so important. You need to pay attention in Spanish class. But when I became a resident and we were seeing a large volume of Spanish speaking patients, I actually went back, got my old Spanish books out. This was before the internet. You couldn't do this online.
Yeah.
Signed up for a Spanish class at the local YM, like the 92nd Street Y in New York City. So that by the time I was working after residency, my Spanish was okay to see patients. And then I did that for 6 years. So my Spanish really improved. Got a little bit rusty over the years in private practice, but now the world is your oyster if you want to speak a foreign language. So I have a Spanish tutor every week. She's in Mexico, she's Mexican, and I get on for an hour with her every week, and she gives me homework, and I do a little Duolingo, but my Spanish is quite good at this
Yeah, well,
point.
there's some of your growth and stimulation that you wanted,
Yes,
right?
yes. And yeah, so most of my patients now, it's a different immigrant population. They're all Spanish speaking, but Guatemala, Honduras, El Salvador, Ecuador, Colombia, more like South and Central America.
Yeah.
And it's a combination of like a lot of really new immigrants, like literally arrived in the country 3 weeks ago, a month or two ago. I've talked to you about this. I have quite a few patients who cross the border alone, families who, you know, are coming for all sorts of reasons and have really endured great hardships, with the goal of having a better life for their
Yeah.
kids. So, you know, whatever the issues with immigration in this country, which clearly need to be addressed, these families are really needy and lovely, grateful,
Hmm.
appreciative people, and it's wonderful to take
Yeah.
care of their kids.
Yeah. But so much of what you do, I imagine, um, is not traditional medical, right? These families need,
Yeah,
when they talk
there's
about the
there's so
social
many
determinants,
levels.
right?
Yes, social
Yeah.
determinants of health and ACEs or adverse
Hmm.
childhood events, you know, um, having
But
a
you have a
parent
team.
who,
So you have a team at
yes, so
your,
we have this team. So it's very much team-based. So let me give you an example for, let's say, mental health. So if I have a kid who, and the first day that I started this job, they introduced me to the head of the mental health team, um, who's a social worker. And we have at Zufall that we have 10 offices and 2 mobile vans. So we have, I believe they told me, 20 mental health practitioners.
mm,
And I didn't quite get it until I started using it. That like they were like, if your patient needs a therapist, just send them to us. We'll take care of it all internally. And I'm like, really?
yeah,
For free? And they speak Spanish? And
right,
they don't have to wait? I mean, I thought that was like a unicorn.
right.
And so the first time I had a patient who, you know, that didn't take very long, screened positive on their depression screen, and I got in touch with the coordinator. She was like, "Oh, is the patient still there? I'll come and talk to them." And I was like, no, they left. I didn't know that you could come and see them right here, because this was someone who this patient had some suicidal thoughts. I didn't think she was unsafe to go home, but she was like, oh, I'll call her right now. And literally by the time I got home from the office that day, the social worker had spoken with my patient, reached back out to me, told me her impression, and made an appointment for follow-up.
Amazing.
And yeah, yeah. And that's just the way it works. And so if I have, and you know, since then I've had a couple of teens, it's not unusual, screen positive, whether you're in private
Hmm.
practice or seeing immigrants who have really undergone a lot of stress and trauma in their life, to have kids who have some suicidality, I will get in touch immediately from my little laptop through Teams to the person who coordinates mental health services. And there is a full-time therapist who is in my office, physically in the office. If she's available, she can pop her head in. You know, you don't even need to say, would you like to see a therapist? I can just say, oh, I have a team member. She's here today, and she talks to a lot of teens who may be feeling stressed or down or anything. Do you mind if she pops her head in and just talks to you for a few minutes? Or if there's not someone, or if, let's say that person in the office is busy with another patient, they'll find someone else who can do a Zoom call
Yeah.
with my patient right in that moment. And this is for the more acute patients where I might be worried about whether they're safe to go home. And so I've had them, let's say, have a Zoom meeting with my patient and then send me a message saying, talk to the patient. She's okay to go home. We came up with a safety plan. Could you just print it out and give it to her?
Hmm.
And, you know, and then I send them home and they have follow-up. And honestly, every time that happens, I'm just amazed and grateful that I can provide this, because it takes a huge burden off my shoulders,
Yeah.
right?
Yeah.
That's just one of the biggest lifts in primary
Yeah.
care, is
So let
finding
me
mental.
ask you, my partner and I, when we started our private practice, we always wanted to, we pride ourselves in trying to, we never could meet what the FQHC does, but we always wanted to take care of that same sort of population and try to integrate nutrition and mental health and all of those things. So we always say, well, we want to try to be like an FQHC, but with a private practice sort of
Mhm,
vibe
mhm.
where,
Yeah, yeah,
where they have after hours and evenings and,
yeah, yeah, yeah,
it's easy to make an appointment and stuff. Do you find
yeah.
that typically with,
community health centers, it's very sort of 9 to 5 and
Yes.
there's not after hours. So
Mhm.
what's the downside to, where are the negatives? Not
Yeah, I mean,
necessarily
that's a
monetary, but-
trade-off. Like we do have Saturday hours. Again, they're very flexible. They really seem to want the providers to be happy. So it was like, you could work out, weekends if you want to, but you don't have to. And if you do, you'll get time and a half credit for that. So that'll reduce your weekday hour
That's
requirement.
great.
Yeah. So I actually do work 1 half day Saturday a month. But it's not like private practice because the volume, it's not like seeing 40 patients on a Saturday. It's coming in and seeing 12 patients on a Saturday. It feels very different. But yes, so after hours, our patients really do end up using urgent care centers, and there's probably a little bit overuse of that. And I think it's something that we can work on. I think there's a lot that we can work on in terms of educating our patients about when to go to the ER, when to
Yeah.
use an urgent care center. We're trying to incorporate more walk-ins. We haven't really done that yet, but we recently moved into this new building where now we have more space. We hope to be doing more of that. But while not overwhelming the staff and
Right.
saying, we're going to open it up to unlimited walk-ins for the first hour or hour and a half of the day, and you'll just see them because, that's what we're going to do.
Sure, because you want your doctors to be happy, but you also need staff. You want them to be happy as well. Totally. So, if people are interested in finding out more about community health centers, FQHCs, do you know where they can go? Or, in your area, you could tell them about your particular place, the Zufall Health.
Yeah,
But
and I know that sometimes we have been looking for physicians to join the group, not in my particular office, and I am not entirely sure where they are advertising, if it's LinkedIn or Indeed, or, I think that when you're looking for a new job, you need to cast a wide net.
yeah,
And you never know where that job is going to come along, and there are job fairs and all these online sites, and you could just, if you're interested in FQHC, you can just put in FQHC in wherever you
right.
are, and that will come up. Like, you'll see a list of all of them. And there are these things called FQHC lookalikes, which I don't really know in much detail, but just because I had to read up a little bit on what this was that I was working for when I started. And so I read about that too, that maybe get some, but not all of the benefits that,
Yeah.
that the government provides.
Well, Aviva, at the end of the day, I'm just happy that you found what was right for you.
So am I.
Yeah. So are you have any last minute thoughts or advice for people, comments before we close?
I think just realize if you're in a position where you're thinking, I'm not sure whether I want to keep doing what I'm doing, I feel like you don't have a lot to lose by looking, and you won't know until you kind of open your mind and reach out to people and believe in what you can do, what might be available for you.
That is a great piece of advice to end on. So thank you so much for joining me, Aviva. I love seeing you.
You too.
All right. And as usual, I will send us off with a great big thank you to all of our listeners for choosing to spend your precious time with us. And I hope to see you again on the next episode of Reinventing the White Coat.
For this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.